Okay, how to choose an EK surgeon. We're going to finish up here because I'm always asked, well, how do I know? I get calls from Massachusetts and whatever. Who should I go see? And it's not just Massachusetts, all over it. And I'm not picking out Massachusetts. I'm just saying. But it's how do you choose a surgeon? Well, it's the same way you choose any doctor or anybody that's going to do something important in your life. Honesty. You got to have somebody that tells you about the pros and cons of the surgery and doesn't do a sell job. The problem is surgeons, like anybody else, they get excited about what they're doing. Lord knows I never get excited, but we get all excited. We want to really kind of go for it. The problem is you got to make sure that there's not a sell job going on where the surgeon wants to do the surgery before you're ready. So make sure you're ready and have them be straight up honest about the pros and cons of the surgery. You need a surgeon that takes time to discuss the issues with you. So you need somebody to sit down and talk with you and answer your questions and it takes the time. And it's tough. It's really tough. I mean, surgeons like you guys have got calls in their time. It's tough to take the time. It needs to be done. And then somebody has experience in the field of corneal transplantation, not an occasional transplant surgeon. If you have a surgeon that 99% of his practice is LASIK, which is a wonderful field and fantastic, but he only does a transplant every few months or so, probably that's not the surgeon for you. And I say that with all due respect to my colleagues that are occasional transplant surgeons. I think that this surgery is more difficult than many surgeons suspect, and they see my videos at the academy and they say, oh, that looks pretty easy. But you can't take a weekend course and then on Monday expect to do a great job. You have to kind of hone your skills a little bit. You have to probably have more experience with handling corneal transplant tissue. It's not like plastic. It's living tissue. It needs care and loving attention during the surgery. So you want to have a surgeon that has some experience. They don't have to have done 500 cases. They don't have to have done even 100 cases. They don't have to even probably done more than 10 cases. But they do have to have done a few cases, and they should be transplant surgeons, people that are very comfortable handling transplant tissue. And so the questions you ought to ask your endothelioplasty surgeon, I think you ought to ask them, what's your surgical technique? To use a 5mm or a 3mm incision. Now, I already had Fuchs dystrophy, Fuchs friends patients ask me that same question. And so that's why I put that up there. They come in, well, Dr. Cherry, what incision size do you use? And I said, wow, it's a Fuchs friends person. All right. And I like that. I mean, I love having patients that are well informed. And so I think you ought to ask them the question, 5mm versus 3mm, because I'm convinced a 3mm incision, using our current techniques of insertion, is worse than a 5mm incision. You ought to ask what the total number of cases is. It's not a problem. Now, if a person is starting out with their EK program, that's fine. You can still get a great result, but they should have already been a transplant surgeon before then. They should have already been doing full thickness transplants before then, and now they're starting their EK program, and they can still do a great job for you. But if they say, well, I used to do 1 or 2 transplants a year for the last 20 years, now I'm going to try this new thing because it looks easy, I wouldn't go with that guy or girl. Okay, what is your dislocation rate is a legitimate question to ask surgery because that's not a good deal. And then I'd ask, what's your pupillary block rate? Because if you're using a technique that causes pupillary block, then that to me is a completely avoidable complication, and it means the technique they're using is not an appropriate technique. In conclusion, then, is endothelioplasty surgery, DELEC or DESEC, should be considered instead of PK in the treatment of endothelial dysfunction. The choice of an EK surgeon should be based upon their honesty and commitment to you as a patient, and their commitment to making your EK surgery the safest possible experience. For those of you that know me, know that